Hi friends, I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things, so welcome to the Dr. Molly Says podcast. What's up, friends? It is a solo episode day today with yours truly, and we are going to learn some things. I started this podcast because I think it's really important for pet owners to be as educated about their pet's health as possible. And I wanted to help you learn things so that you can make better decisions for your pets because you understand how these things work. And so today we are going to do a deep dive into a topic that's really important and a disease and infection parasite that's really important, and that is heartworm disease. So if you are listening and you're not in the US, not all countries have this disease, but heartworm disease is caused by a parasite that is quite prevalent in particularly some parts of the United States of America, but it has now been diagnosed in every state in the US. And so this is a really relevant topic. It is the summer here. It is the beginning of July in Tennessee, and it is hot, and there are mosquitoes everywhere, and mosquitoes play a big role in heartworm disease. So this is an episode all about heartworms and how the disease works, information about the parasite, how we treat for it, and how we can prevent it. And it's all important because heartworm, like I said, has been diagnosed in all 50 states. It used to be more of a regional disease, and it is spreading. There are a lot of factors that are to blame for that, but we are diagnosing it in all 50 states. Some of this is because of more transfer of dogs across state lines because of rescue organizations that are doing a great job of getting dogs adopted out. But in areas where there's a lot of dogs that need homes, they often get shipped to other parts of the country. And so that is contributing, we think, to the spread of heartworm disease. There are pockets of the U.S., depending on climate, where there is less heartworm disease, and we're going to talk about that. So heartworm disease is caused by a parasite, and so it's important for you to understand who this parasite is and what they do. So the parasite is called Dirofilaria immitis. I made myself a really good outline that I'm going to try to follow. So this is a nematode. So this is a type of like roundworm. We think about intestinal parasites when we talk about roundworms. So this is a worm. It is a nematode. There are different life stages to it. We're going to get into all of that. But the adult heartworms, Dirofilaria, they live in the cardiovascular system of the host, which is the dog, and other canids. So foxes, coyotes can have heartworms. So these worms, as they mature and become adults, they want to live in blood vessels between the heart and the lungs, which is really cool and weird and gross. So their preferred location is the pulmonary arteries, so vessels that run from the heart to the lungs. So the right ventricle and the right atrium are the two chambers of the heart that are connected to that, basically. And these worms can move into those chambers of the heart as the disease progresses, and there are more and more heartworms, and they run out of room in the pulmonary arteries. So there are female and male worms. The adult females, I don't know if you've ever seen these specimens, but they can be huge. So they're these long worms. They can be 10 to 12 inches in length, the females, and they can live 5 to 7 years. So these are hardy parasites. These are worms that get very large, and they're very intentional, and they can live a long time. Adult males are smaller. They are 5 to 7 inches in length. And when dogs are infected with heartworm and they have adult worms in them, they can have anywhere from just a couple of worms in their cardiovascular system to over 100 in really severe infections. And we'll talk about what that looks like. So it's important to understand the life cycle of heartworms if you really want to understand why we do what we do for prevention and treatment and why we recommend what we recommend. So I'm going to get into it. Hang on, hang tight. Stay with me. It's very interesting. The life cycle of heartworms and all parasites is very interesting, but we're going to walk you through it. So the adult females that I was telling you about that get really big, they are really important in the life cycle of heartworms, because if we talk about adult worms, if they're already infected in a dog, those adult females release eggs, which are larvae, and they're not really eggs, but they're like eggs. So their live larvae are what the adult females reproduce. They do have to mate with male heartworms. So my parasitology professor in vet school, Dr. Patton, she said, the heartworms, they get married and they make a home in the pulmonary arteries and they make a lot of babies. And so that's what heartworms do once they become adults. So the life cycle of heartworms is very cool and unique because it requires two hosts. So the dog or canids are a host, but then the mosquito is a very important vector, and they are required to continue the life cycle of heartworms. So if you didn't know this, mosquitoes are what carry and transmit heartworm disease. So your dog can't catch heartworm disease or get heartworms as parasites from contact really with another dog. The mosquito has to actually transmit from one dog to another, which is interesting. So there's not direct infection between dogs. It requires a mosquito to be the intermediate. So basically, if we want to talk about life cycle, the easiest way to think about it is let's start with a dog who is infected. Okay, so this dog has previously been infected with heartworm disease with a parasite. It has active disease. There are adult male and female heartworms in its cardiovascular system. They are reproducing, and those females are releasing the larva, which is what we call microfilaria. That's the name for the baby heartworms, if you will. This dog may appear perfectly healthy because the heartworms are not causing obvious clinical signs yet. But they are producing microfilaria. Lots and lots can be produced at a time, all day, every day. They're like rabbits in there, reproducing, making these microfilaria. So those microfilaria are circulating in this dog's bloodstream, okay? So then what happens is a mosquito has a blood meal, bites that dog, and when the mosquito consumes that dog's blood, it also ingests microfilaria. And so that mosquito has been infected with microfilaria, and it is now an intermediate host of heartworm disease, of Dirofilaria. So inside of a mosquito, the microfilaria has to mature. They go through what's called molting. So the larvae mature and develop through different stages. So inside of the mosquito, they have to go from an L1 to an L2 to an L3. And an L3 microfilaria is the infectious stage of the heartworm. And this takes up to a couple of weeks. Temperature, climate can affect whether this even happens. And this is why we do have some pockets in the U.S. where mosquitoes are not very good at transmitting heartworm disease. And so prevalence is lower. And so those are good places with cooler climates. At certain altitudes, this doesn't happen as well. And so if some people live in areas like I used to practice in Western Colorado up in the mountains, we didn't see a lot of heartworm infection because our mosquitoes there, we didn't have many in the first place. And they also could not mature those microfilaria. So cool fun fact. So once those larvae, microfilaria, become L3, they're infectious, then the mosquito can transmit those to other dogs that they bite. So what's interesting and a lot of people don't realize is the way mosquito infect dogs, they don't just like inject the microfilaria into the dog's bloodstream. They deposit those L3 larvae onto the dog's skin, and those larvae enter the dog's tissue through the tiny microscopic mosquito bite that the mosquito has made with their little, there's a name for it, but the thing that they bite with. So it's not injected directly into the bloodstream. And those larvae, they just kind of like hang out, migrate through tissues of the dog, and they mature and molt again to become L4, which is just another stage of the microfilaria, the larvae, and then they become immature adults. And that's when they get into the bloodstream, is once they are maturing into adults. And that can take a couple of months to happen. So a lot of people don't realize that the larvae are just hanging out until they mature enough to get into the bloodstream. And then once they get into the bloodstream, they really want to make their way to the pulmonary arteries where they can find themselves a mate. A female and a male can mate and make more microfilariae. And during this time, this dog that's been infected with microfilariae and heartworm, they're not going to have any clinical signs whatsoever. This is going to be a totally normal seeming dog. Nobody is going to know that this dog has been infected. So if they're not on prevention, this is how they get infected. Nothing stops that maturing into the immature adult of the heartworm and going into the bloodstream and making its way to the pulmonary artery. So 70 to 90 days after all of this starts to happen, they can get to the pulmonary arteries. They make a little homestead there and they continue maturing. They mate. And then once they mate, they start producing microfilariae, that original L1 stage of the larva. And then that's how that ends up circulating in the dog's bloodstream. And then a mosquito picks that up and we just continue the cycle and spread it to more dogs and more mosquitoes, if that makes sense. All right, so that's the life cycle. That's how this is spread. So what happens inside of a dog when they are infected with heartworm? So those adult worms that are inside of the pulmonary arteries, they've been in that dog's body usually for 6 to 7 months before they start reproducing and making microfilariae. And this is when a dog will become positive on a test that your veterinarian might run to test them for heartworm disease. And this is why the timing of testing, the frequency of testing, and maybe things your vet recommends when we are not sure about heartworm status can be a little bit confusing, because from the time we get infected with heartworm to the time we're going to show up positive on a test we can run in our clinics, there is quite a lapse. We think about 6 months before we're going to have a positive test in the clinic. And so that's why if a dog is not protected by prevention and we run a test and it's been, 3 months since they were off of prevention, that test probably going to be negative. But that doesn't mean they don't have heartworm trying to mature in their system. And if they do, then in 3 or 4 more months, they may then be positive, because now those worms have matured enough and they're in the cardiovascular system and they're making microfilariae and reproducing. And this whole time, once they become mature, then they're also spreading it by infecting mosquitoes. So one interesting thing, why does this worm want to go to the pulmonary artery? It's a very specific location. The reason we think that that's their preferred environment is because it is an area with a lot of blood flow, obviously. So there's constant blood flow, oxygen is provided there, lots of nutrients in that blood, and they're large vessels, so they can fit worms, physical worms who want to hang out in there and reproduce. And so people don't really know this, but heartworm disease is really a lung disease before it's a heart disease. So blockading that vessel from the heart to the lungs. So what do they do in that vessel? Why is it a problem? So the worms actually physically rub the vessel walls, and this creates irritation, this constant inflammation on the lining. Vessels are very sensitive, arteries and veins. They're very sensitive, little tiny pieces of tissue. And so constant rubbing irritation to the wall causes endothelial injury, is what we call that, constant inflammation. This can cause fibrosis. So the tissue will actually thicken and harden in response to that. And that can cause slow narrowing of the actual space in the vessel where blood can go through. And then we also, as we have more and more adult worms that are living there, we just physically have less space within the tube of the blood vessel because there are worms there and they shouldn't be there. And so over time, that narrowing for all of those reasons causes what we call pulmonary hypertension. So it's harder for blood to get through that vessel, and that causes more workload on the right side of the heart where it's trying to push blood from the heart into the lungs. And you can have coughing because of that hypertension in that vessel that connects the heart to the lungs. You can have right-sided heart enlargement and heart failure, which leads to backing up of fluid into the abdomen, and then eventually just complete breakdown of the cardiovascular system because you have this like physical blockage. Obviously, because the narrowing of that artery causes blood moving into the lungs to be lessened or not as efficient, you're going to have reduced oxygen exchange. So the system of blood going from the heart to the lungs and getting oxygenated and going back is not going to work as well. And so things are just not working the way they're supposed to. And your heart and your lungs are really important things for your body. So this wreaks havoc over time. The interesting thing about heartworm disease is that damage to this system starts a long time before symptoms appear. I often see people online who, for whatever reason, think that like heartworm disease isn't a big deal and we don't need to give our dogs prevention. I see people say like, oh, my dog never took prevention and they were fine. Well, I think in a lot of cases, there maybe are dogs who are infected with heartworm disease. They never get tested. They never get diagnosed. They die from something else before we started to see the end result of it. But damage from this disease and this parasite happens a long time before the clinical signs appear. And the clinical signs of heartworm disease, like I said, coughing is often one of the first things that we'll see. So because of the irritation and the hypertension in the pulmonary vessel, we just will see cough for different reasons. So a lot of these dogs will start coughing. Often exercise will induce the coughing, and that's because as they exercise, more blood flow is trying to go through those vessels, and that can cause the coughing. So coughing is something we see. Exercise intolerance is something we say a lot about heartworm dogs. So they want to play and run, but they just get tired really quickly, and that's for all of those reasons. Their oxygen exchange isn't good. They have pulmonary hypertension. They just get tired easily. So exercise intolerance, sometimes a mild cough at first. They just start to get maybe like more lazy seeming. They just don't feel great. They can have some weight loss. Their appetite can go down. As the disease progresses and things get worse, their cough can become more persistent and they can start having actual respiratory changes all the time. So they're breathing harder, they're breathing faster, they have a hard time getting their breath. Then they start to have heart signs. So signs of right-sided heart failure. They can have syncopal events where they like pass out because of everything that's going on. And eventually, with right-sided heart failure, they'll start to get fluid buildup in their abdomen because the blood is not going through their heart the way it's supposed to. And so because their liver moves their blood up to their heart, part of that whole system, they will just get fluid that backs up into their abdomen. So we'll see horrible long-term cases of heartworm disease sometimes in like feral dog populations where they've just been infected so long they just have huge abdomens full of fluid. And we call that ascites because they're in right-sided heart failure from the actual physical heartworms that are in their heart and lungs. So caval syndrome, you may have heard. This is the like end result, true emergency for a dog that has heartworm disease. So caval syndrome is where their pulmonary artery just gets so full of these worms that all of a sudden they just back up into the right side of the heart. And so then those chambers in the heart are actually getting full of these physical, gross, long worms. And these dogs just suddenly collapse. They're very, very sick. They often die quickly. If they don't die, the only way for them to survive is to have emergency surgery to physically remove those worms. And obviously that's like a big deal surgery. So it often isn't an option for these patients. So that is what heartworm does. It can take months to years for an infection of heartworm to actually cause symptoms. And once symptoms begin, it usually means they have been infected for quite a while, and so a lot of damage has already been done. And this is why we might call it like a silent killer, because they can seem fine until we just get over that cliff and now we're not fine and things are really bad. And this is why veterinarians want you to know that preventing heartworm disease is so, so important, because we are who sees the other side of this and the eventual effects and what it looks like when a dog is very sick with heartworm disease and dies from heartworm disease, because it's very devastating and it's a very, very terrible terrible way to go and terrible way to be sick. Another interesting thing, just another sort of side thing about heartworm, Diarrhea, the parasite, is that they have this like symbiotic relationship with a bacterium that's called Wolbachia. And this is, you're going to remember this when we talk about treatment. So Wolbachia is a bacterium that helps heartworm, Diarrhea be who they are. So they are needed for their development and fertility and their survival. But you need to know about Wolbachia because when we kill heartworms, because we do when we find them, they die and that Wolbachia gets released. So it's this bacterium that's inside the heartworm. And that massive release of this bacterium can cause more inflammation and can trigger almost like an anaphylactic reaction in a dog or lung injury, vascular damage. So Wolbachia are part of the problem with heartworm disease. And so we have to address that as well when we treat dogs for heartworm. So testing for heartworm disease, typically what your vet is going to recommend is annual heartworm testing. We have a great in-clinic options, quick snap tests for this. And this is testing for the presence of antigen from adult female heartworms. So you may hear your vet say, we're going to do a heartworm snap test or a 4DX. Some of these heartworm tests are combined with tests for antibodies to different tick-borne diseases, and that's just a convenience thing. But there are just basic heartworm-only antigen tests, and these quickly tell us, basically, are there adult female worms in this patient? Because it is detecting proteins from those. So it is not going to tell us that we have immature worms, and if there are male-only infections, which can happen in weird situations, they may not be positive. But this is a great test that we run. It catches most of our heartworm positive dogs, and it can quickly tell us, do we have an infection with adult female heartworms? So it doesn't tell us that a dog was infected by a mosquito with heartworm 2 months ago. It just tells us a dog has been infected long enough to have adult female worms, if that makes sense. So if we run an antigen heartworm test in the clinic and it is positive, the next thing usually a vet is going to do is test for microfilaria, those larvae in the bloodstream. We can do that quickly in the clinic with a direct blood smear. So we literally put blood on a slide, we look under the microscope, and you can see the microfilaria in the bloodstream. It's very cool, very gross, very terrible. If we have a dog that's on monthly preventatives, then we might not see microfilaria because those preventatives are killing the microfilaria. But if there was a gap where they got infected and then they got on preventatives, that's when we can maybe have a positive antigen test and then don't see microfilaria. There's also some other tests that more advanced labs can run, like what we call modified knots, to confirm or deny the presence of microfilaria. But usually what we're going to do, we run a test in-house, it's positive, we look for microfilaria, we're going to send a confirmatory test out to an outside lab because we always want to make sure that we for sure are positive for heartworm before we do any kind of treatment. And so once we have all of that confirmation, a dog is positive for heartworm, then we talk about working that patient up to see if there's anything else going on, what kind of effects has the heartworm infection already had on the dog, and then we make a plan to treat it. So quickly, I just want to run through the sort of diagnostics that your vet might offer you if your dog is positive for heartworm. I think this is important because sometimes people get confused on why we're doing or offering these things. So x-rays of the chest are usually going to be offered to you. If your dog is, especially if your dog is coughing, has any symptoms of heartworm. We often diagnose heartworm in dogs who have no symptoms because, like I said, it can take a while for those to appear. Chest x-rays are just going to tell us what is the heart size and shape, what do the lungs look like, do we see any other kind of disease that we weren't expecting, like a tumor in the lungs. We just want to rule out other things, see if we have any sign of heart failure yet, and just get a good picture at everything. Sometimes an echo, so an ultrasound of the heart, is going to be offered, especially if a dog has symptoms of heartworm disease, especially if it seems like maybe advanced disease. This is going to give us a better idea of like how many physical worms are in the cardiovascular system. Blood work is also something that's always going to be offered or should be offered to you, I think it's always a good idea to at least run blood work, like general blood work in heartworm positive dogs. One, let's make sure nothing else is going on: kidney disease, liver disease, autoimmune disease. So CBC, chemistry panel. Let's just see how our organs are doing, make sure we don't have any concurrent disease, make sure it's going to be okay to treat that, because the treatment is somewhat harsh. And then treatment will begin. So treatment for heartworm happens in a few phases. And I just want to say there is the American Heartworm Association and Heartworm Society, I'm sorry. And they are this very, very wonderful expert group of people who make recommendations about how we treat heartworm, how we prevent heartworm, and what's happening with heartworm right now. And the guidelines for treating heartworm has changed a few times over the years. And so it's really important that your vet is staying up to date with what the current recommendations are for treatment. So right now, the best treatment is a multi-stage protocol. So I'm going to go through that. There are some alternative treatment options in cases where we can't afford to do the normal treatment, or patients that have other issues, other things that are going on. But for an otherwise healthy patient who can tolerate normal treatment, here's what we do. Once we diagnose heartworm, we're going to treat it. We're going to want to start a round of doxycycline, which is an antibiotic that's going to kill or treat the Wolbachia. Remember those bacteria that the heartworms carry? So this is going to help prevent a major inflammation reaction to the bacterium that's going to get released. Okay, so doxycycline is really important. We're usually going to do that for 30 days once we diagnose. Also, at the time of diagnosis, if we're not on a heartworm prevention, we're going to get on a heartworm prevention. And what that prevention is going to do is to prevent any young larvae from then becoming more adults. So we're going to stop the cycle where it's at. That prevention's not going to immediately kill adult worms or anything. It's just stopping it from worsening. And some of those adult worms can start to die once we go back or we start prevention. And so that's why that doxycycline is really important for the Wolbachia. So 30 days of doxycycline. We're going to start some real exercise restriction, because what can happen is as these worms die, we can get emboli in blood vessels in the lungs because of all of this stuff breaking down. And so we don't want to get their blood pressure up and push things through vessels if we don't have to. So leash walking, really keeping your dog rested is really important for the whole treatment. And that even starts right at the beginning. So 30 days of doxycycline, and then we're going to take a 30-day break. We're going to continue heartworm prevention the whole time, every month, same time every month. We take a month off of any kind of treatment, and then after those first 60 days, we're going to do our first imidacide treatment. And imidacide is the actual treatment that's going to kill the adult worms. And imidacide, which is melarsamine, is an arsenical compound. This is a very nasty drug. It can have yucky side effects. It's the only FDA-approved adulticide, so a drug that's going to kill the adult worms. And it causes them to die gradually. And then what happens is the body and the immune system is going to clear them. The body and the immune system is going to do its job and clear them over several weeks. So after those first 60 days, we give the first dose of imidacide. The way we give imidacide is an injection into the muscle. That's how we administer it. It's a very deep injection into the muscle. We shave that area. We give it over a muscle that's over the back. We shave and prep that area. We give medications for pain. We give steroids to prevent that inflammation. And we're going to watch those patients in the hospital usually for at least for a day and just make sure they don't have a reaction. Dogs can have a reaction to that injection. They can have an anaphylactic reaction. It can make them sick. It often makes them sore. But usually if they do well for the first 24, 48 hours, they're going to do okay with it. So we do 3 injections. So we give the first injection, we give steroids for a month, and then we give a second injection, and then we actually give a third injection the next day. So we give one injection one day, do steroids for a month, and then injection 2 and 3 are a month later. So that whole process of going from diagnosis, a month of doxycycline, a month off, our first injection, and then the second and third injection is over like a 4-month time period. After those 3 injections, which is what we now know does a good job of killing off the adult heartworms, we will continue exercise restriction of these dogs for a few weeks. So I usually tell people, for several weeks, we're going to be really strictly resting these dogs while these worms die off. The healing for this whole system can take weeks to months. We can have permanent damage to the cardiovascular system because of the worms, depending on how advanced things were when we treated. And then we're going to retest for heartworm disease about 6 months after we finish the injections, just to make sure we successfully killed everything off. So if you have a dog that's diagnosed from heartworm, that's kind of what you're looking at. The cost of heartworm treatment is high. It can be thousands of dollars for big dogs. The actual imiticide, that injection is quite expensive. So it's costly, it's dangerous, and it's ironic to me. A lot of people who are like against giving heartworm prevention, they're like, oh, that prevention isn't natural. It's bad for your dog, even though it's just a anti-parasitic. But then the treatment for heartworm disease, if we want to treat our dogs for it, is a literal arsenical compound. So I think it's important for people to understand that, because if your dog is diagnosed with a heartworm, your options are limited, and really that's the best one. All right. The last thing, and perhaps the most important thing for us to talk about, is prevention for heartworm disease, because newsflash, we can prevent it. So we should do it. There's some online hubbub about heartworm prevention, about how it's so bad for your dog, and it's just not true. And the preventative medications that we use to prevent heartworm disease, they're dewormers. So they are parasiticides. Everything that we use, there's a few different options as far as what medication is in the preventative, but they all belong to a class of drugs called macrocyclic. Sorry. Macrocyclic lactones. I don't know why I always have a hard time with that word. Ivermectin. If you've never heard of ivermectin, who are you? But ivermectin is kind of like the OG one we all know about. Lots of people think ivermectin is the cure-all for everything, but ivermectin was originally kind of what was used to prevent heartworm disease. Others, milbemycin, moxidectin, and selamectin. These come in different forms. There are monthly oral preventatives. There are long-acting injectable preventatives. But there are topicals, but they all use one of these medications. And what they do is they kill the immature microfilaria. They prevent them from maturing into adults that go into the cardiovascular system, which is why it's really important that these are given regularly whenever they're supposed to be given. If it's a monthly product, that they're given every month at the same time every month, so that we don't allow any of those immature heartworm to slip through their cracks, get past the point where a preventative can kill them and be able to become adults. So that is what preventatives do. They have very few side effects. There is very, very, very little risk in giving heartworm preventatives. Some people take ivermectin on a daily basis because they think it keeps them from getting cancer. So it's really not a big deal to give a macrocyclic lactone to your dog once a month. Or there are injectable options. So there is a 12 or 6 month injection. There are also topical options. I don't care what you use. I just want you to give your dog preventative for this, especially if you live in a hotbed for heartworms. So the Gulf Coast, southeastern United States, Tennessee, we are in hotbeds. So those are sort of the areas where it's like your dog's going to get heartworm if they're not on prevention. Like I said, it's been diagnosed in every state of the U.S., but we have some emerging hotbeds. But this area, southeastern United States, the Gulf Coast, lots and lots of heartworm disease. Something else that's interestingly happening, we think, is some emerging resistance to the OG ivermectin. So there is some research coming out that is showing evidence of reduced sensitivity to ivermectin. So ivermectin is the macrocyclic lactone that's found in HeartGuard. And it's just been around for a really long time. We think there are some heartworm isolates, so some Dirofilaria that are resistant to ivermectin. And so they are the survivors. And so prevalence of that Dirofilaria that is resistant is probably growing and will continue to grow. We don't think that there's widespread resistance across the U.S., probably just in these hotbeds like where I live. I have definitely diagnosed heartworm disease in a few dogs that were on preventative that had ivermectin in it. So also people who are like, well, I just give my dog some ivermectin from the feed store every month. Well, that also may be not a reliable method of preventing heartworm disease anymore also. So food for thought, something to know, something to think about, especially if you live in a hotbed of heartworm like the Gulf Coast and the southeastern United States. And we're, veterinary research, parasitologists, epidemiologists, all these scientists are working very hard to figure out, is this real? Are we resistant? What drugs are best? How can we overcome this? Who needs heartworm prevention? When do they need it? So in a lot of places in the U.S., it's really important that we give heartworm prevention every month, year round, because anytime can be a mosquito around, we can have heartworm infection. And we also want to keep giving that prevention even after times when we have a lot of mosquitoes. So I do know people who just give heartworm prevention during strictly the spring, summer in Tennessee. That's a bad idea. I would not recommend that. I would give it year round. I have absolutely seen mosquitoes in the winter. Sometimes we can have warm seasons within cold seasons, and it's just really not worth risking it. So consistent administration is really important. You want to give it the same time every month. The timing is really important. I would, talk, if you're worried about what kind of heartworm prevention you're giving, talk to your vet about it, see what your options are. But I would absolutely give it. You cannot get heartworm prevention over the counter, so you do need a veterinary relationship and a prescription to get it. That's because we always want to make sure your dog is negative for heartworm disease before we put them on just any preventative. That is why your vet recommends a test every year, even if they're on prevention, because we do see breakthrough cases sometimes. And also, we know that we know that you may not be giving it every month, even if it's at your house. We're all guilty of that, myself included sometimes. So there is a reason your vet is recommending a heartworm screening test every year. They don't just want your money like some people want to say. They're just looking out for you and your dog. So that is very normal for them to require a heartworm test every year to keep writing you prescriptions for heartworm prevention. And it is also normal for them to require a heartworm test if your dog has been off of prevention before they get started on it again. So I hope this has been helpful. There are a lot of myths and misunderstandings and misconceptions about heartworm and heartworm prevention. Hopefully this helps you understand why we recommend what we do. If your dog lives inside most of the time, they still need heartworm prevention because mosquitoes do not live outside all of the time. So prevention is key. It's really important, and heartworm is devastating, and I would love it if we never had to treat a dog for heartworm ever again. So let me know if you have questions. Let me know if there's anything specific that I didn't talk about that you want to hear about. And we will see you next week. You can find me at Dr. Molly Says Pod. If you're listening, you can watch this. If you're watching, you can listen. Recently, someone told me my microphone is very distracting on YouTube, and I did not know what to say about that. So I don't know. Maybe they should just listen and not watch. But I will see you next week on the Dr. Molly Says podcast.